Good day and welcome. My name is Kelvin Ampofo, and I am the immediate past. Brothers understand, former Basala understand, anybody that's been in a leadership position understands what immediate past means. I'm the immediate past second district representative of the Omega Psi Phi Fraternity Incorporated, and I want to welcome you again to our monthly webinar series on COVID-19. Certainly, as I've indicated, I'm the immediate past, so I want to start off. I want to salute, I want to honor, I want all of the brothers of the second district to recognize our 38th district representative, Brother Delrico Gales. We certainly want to thank him for allowing this COVID-19 task force team, the Four Horsemen. We want to thank him for allowing these brothers to continue to serve the communities worldwide as we unfortunately continue to have these discussions as it relates to COVID-19. As always, we also want to acknowledge our grand bosses, Dr. David E. Marion, our grand bosses of this fraternity, who has just done a phenomenal job throughout this pandemic. As always, let me say the comments that you will hear today, those are the opinions of the brothers. They are their own comments. They do not represent the Omega Psi Phi Fraternity Incorporated or any business or affiliation that they may have with other organizations or their employers. So, as you all know, the Four Horsemen, we have two of the Four Horsemen with us to share for this month's monthly webinar. Certainly, as we know, Dr. Keith Boykin, who is a retired pediatrician, always gives us the stats, always gives us the latest and greatest as it relates to our young people. Dr. Boykin, good evening. And certainly you all know Dr. Jedan Phillips. He is a doctor. He's a family medicine doctor. Again, Dr. Phillips brought us the information from day one, right from where he was, from the emergency rooms, and also from what he's been seeing in his practice with his patients. So certainly want to acknowledge all of our Four Horsemen, Dr. Guyton, as well as Brother Wonzie, Gardner. These four brothers have just simply done an amazing job throughout this pandemic, and we want to ensure that they still have the opportunity to share the information to make sure that we all are up to date as it relates to this unfortunate COVID-19. So let's start off. Dr. Boykin, let's start off. Good afternoon, good evening, my brother. Share with us what you have at this point in time as far as where we are with this COVID-19.
Well, good evening, everyone. And again, welcome. And I appreciate the opportunity to, again, come before you and talk about where we are with this pandemic. I know there have been some words out in the media that we're now in an endemic, but I don't think the pandemic is quite over yet, because we look back at things. We know that if we compare this is May, we compare this to around March time, end of March, that we are now on the uptrend again of cases. We're over 104,000 daily new cases a day of COVID-19. Deaths still only about 279 new cases per day, but we're getting very, very close to that 1 million mark. I know plenty of outlets have reported 1 million, but the CDC's website said we're still only at 999,785. Hospitalizations are increasing. We're about 3,300, a little bit over 3,300 cases per day. But the interesting thing about that is that all of those may not be due to COVID-19. As a matter of fact, the hospitals are now being overwhelmed with people that are now trying to get those procedures that have been postponed. So a large majority of the hospitalizations are going to be those people that are getting their procedures done, whatever else they have not gone to the hospital for, as well as now we still have the amount of COVID people going up. So now it's going to be a different burden on the system because we have COVID and we have other hospital business that's taking up the hospitalization. So we have to prepare for that as healthcare workers in hospitals across the nation. Now, the other thing that's going on out there, we talk about these variants. We know, Omicron is not gone anywhere. Matter of fact, Omicron is being very, very, very sneaky. And it started out as BA point, whatever it was. Then it became BA.1, BA.2, and BA.2.1. But now there was a variant that originated in the northeastern area. As a matter of fact, the first identified in New York City is called BA.2.12.1. As of last week, it was not this predominant circulating variant out there, but it has overtaken BA.2 to the tune of approximately 57 or 58%, depends on what you look at, the CDC's data. And the OBA 2.2, the stealth variant, has crept down to about 30-some%. The original variant is still out there, so it's not gone anywhere. And, you know, Delta variant is still a variant is being monitored. So it's reported out at 0% in our nowcast on the CDC website, but we haven't remember that it's still out. There's a possibility out there. So what are we doing? You know, now we have vaccinations, you know, still out in the forefront because we have now the FDA and the CDC has endorsed booster shots for our 5 to 11-year-olds. And right now, the only ones that can do that, obviously, is Pfizer, because they're the only ones that have vaccines out there that's been approved for that age group. But Pfizer, as well as Moderna, are looking at the younger age groups. Moderna has submitted their data to the CDC for their 6 months to 4-year-olds or 5 years, depending on what you look at. And Pfizer has gone back and submitted their data because they now know that for that age group, we probably have to have a 3-dose series as opposed to a 2-dose series for the 5-year-olds and above. So, and the dosages are going down as we just distribute those out more. So we have, hopefully by school year next year, hopefully within the next a couple of months, we will have those vaccines approved for the age group. You know, that has resulted, unfortunately, in some hesitancy on the normal vaccination, which we'll probably get into a little bit later. You know, people that are hesitant to give this COVID-19 vaccine are now having more hesitancy for the routine vaccinations out there. You know, our vaccination rates overall are only about 77.8% for 1 dose and about 66.6% people that are fully vaccinated. And our booster rates for the first booster is only about 46.6%. And we can break it down into probably about 21% for over 50 who's got a second booster, and about 26% who've got over 65 that got a second booster. So, you know, we're getting there. And, you know, the interesting thing, you know, we've reported out here many times before about the vaccination rate in African Americans. Well, the CDC has finally put out a different way to report the data on African American people. You know, if you look at by ethnicity, about you know, we got 76.5% ethnicity rates on the vaccine. And we look at the African American people, about 43.9% did get the booster vaccine once it became available, but still 56.1% have not gotten it. And we look at the overall vaccination rates from December of 2020 to May 24th, 2022, 48.2%, I'm happy to say, of African Americans have gotten 1 dose, and 42.3% are fully vaccinated. But when we compare that to the U.S. population overall, we still lag behind. We're still in the teens in terms of where we are in the vaccination. So we know that a lot of things are coming out of the pack, but that's what the numbers are now. And if we look at the transmission rate, which we do need to pay some attention to, a lot of I think a couple of states in the United States have gone on red, which is high, and that means if you're in a transmission rate high, you should consider doing all the mitigation things we talked about before: masking, hand washing, and social distancing. And in my area, in the DMV, most of us are in the yellow, the cautious area. So that means if you're immunocompromised or you have any underlying condition, you should consider wearing your mask. So, you know, there are only very few counties in the area that are still low. And I know where we're going to have our next great gathering. The last I looked, Charlotte, North Carolina, in Mecklenburg County, it was low transmission rates, but that may change very much so. So that's kind of an overall picture of where things stand in terms of risk and statistics as we go forward at this particular time. So I'll yield at this time. We can't hear you, brother Ampofo. We can't hear you. We lost you.
Can y'all hear me now?
Yeah, I can hear you now. Great.
Okay. You know, it's technology, right? It happens to all of us.
That's
so,
right.
As always, Dr. Boykin, you always bring it to us live, man. You always give us those stats, man. Just thank you, man. And we just appreciate you. Dr. Jedan Phillips, here we are, man.
Hey.
Queens.
Actually, Queens is hot right now.
What's good? Go ahead, break it down to us. Break it down.
Well, you know, again, you know, Dr. Boykin is always a hard act to follow. You know, he sort of puts everything we need to know out there, and he rarely misses any places that, you know, he's overlooked. So again, I appreciate that. But what have I been seeing as a family doctor in New York? What I am seeing is that we are still seeing a lot of people get COVID. Now, unfortunately, as it was alluded to earlier, we have seen in the New York area that our numbers of cases have, over the past 2 weeks, have gone up. And the major culprit of it, and when I say go up, New York has now moved back into the red range, where they are strongly encouraging masking in group gatherings or indoor gatherings. No mandates yet, but, again, the recommendations are there. And I think that's the important part. I think, again, we're not going to shut down anymore as a nation. I don't think New York's going to shut down, but I think that it's important for people to be aware of what their risks are personally and what their tools that they have to protect themselves. I think, as Dr. Boykin alluded to earlier, what are the risk factors as far as the people we're seeing getting COVID? A majority of the cases tend to be mild, but I would say in a good amount of those cases that I'm seeing, those individuals with a mild presentation are already vaccinated. Now, one of the little nuances of the vaccination that we've got to be mindful of, I just had a patient who had his primary 2 vaccines, and in probably September of last year, received his first booster shot, never got the second booster shot, and he was over 50, had medical conditions that would make him a candidate or eligible for the second booster, and a couple weeks ago traveled down to Florida, unfortunately contracted COVID, and unfortunately did not die, but had pulmonary embolus, had pancreatitis develop. So a lot of these medical conditions, and is a good, candidate for possibly some long hauler symptoms. So my point is, it is still out here. And these newer variants that are subvariants of the Omicron variant are, unlike what we saw in the beginning, are significantly more infectious. May not have the severity as the Alpha and the Delta strains as far as the clinical presentations. But again, if you are a person who's vulnerable, if you are a person who's not vaccinated, again, I think that these things are going to make you think. Because again, like I said, my patient had his 2 shots, had a first booster, and unfortunately did not have the second booster, which he was eligible for, which, as we've shown and Dr. Boykin's slides have shown us before, we are seeing a decrease in the protective nature of their immune system if they fall out of that window where they become eligible for the second booster. So what am I saying? My message to my patients are, again, how do you use these tools in front of you to protect yourselves? I think that there are a couple other things as we look forward that we need to be mindful of, because I've been to some large gatherings and I have seen after the fact, because I'm the type of person that calls and says, hey, how's everybody doing? I have seen that in these gatherings, COVID is still there. We're seeing cases of COVID that are popping up. Now, fortunately, in a majority of these spaces I've been in and the people that have contracted it, they were vaccinated. So fortunately, their presentation of COVID was mild. But what if somebody didn't get their second booster, which, as Dr. Boykin just said, you've got folks who are like, I'm going to get my first shot. I don't know if I need the second shot. I got my 2 shots or my 1 Johnson & Johnson. I don't know if I need the booster. I've gotten my booster, and I don't know if I need to get the second booster. And what we have mentioned on these calls is that if you fall out of that window with the booster, at least up until the second booster, after the first booster, after about 4 to 6 months, you're seeing a decrease or a drop in your immune system's ability to fight off COVID. So if you're a person that may have risk factors, what are risk factors? Age is a risk factor. Again, over the age of 50 for the booster. But In reality, we've been saying the over the age of 65. Obesity, heart disease, diabetes, lung disease such as COPD, emphysema, or asthma. These are autoimmune conditions, cancerous conditions. All of these scenarios put you at risk. So again, back to what I said at the top of my comments, we've got to recognize what our personal risks are, because again, now you can't look at somebody and say, hey, put your mask on. I don't have to put my mask on. I don't want to put my mask on. And at the end of the day, unless you trying to, go to war with everybody, what you've got to find or find out is, what are my risks? And sometimes I find that's a great space to discover that. See your doctor. In addition to that, what are the defensive mechanisms that I have? If your doctor, if you have questions about the vaccine, if you have questions about the first booster or second booster, it's important to have this conversation with your doctor, because again, you know how we are. I did a little bit. Do I have to do all of it? And this is sometimes the mentality you see with the booster shots. In addition to that, I think another thing that's very important is with that engagement of your doctor. If you are diagnosed with COVID, that also lets you know what treatment options may be available to you. I was just so back, as we may have, Dr. Boykin and I may have said a couple years back, we're back to every day there's a couple people that I have to call that have COVID, and I have to make sure that they're doing okay. And one of the things that's available now that wasn't available before is the Paxlovid, or the oral antiviral medication. And they have been already shown to be effective in minimizing symptoms. And what do I mean by that? And why is that important? If you are a person that has poorly controlled diabetes, which already can affect your immune system in a negative way, if you get COVID, especially if you're unvaccinated or not boosted and you're eligible, your immune system might not have the ability to fight off COVID. So it's going to need assistance. And it's important in that conversation and letting your doctor know, hey, I just got diagnosed with COVID. What do I need to look out for? What is available for me to help myself? So again, it is important to make sure to engage your doctors. Now, we are fortunate in New York where we actually have a city number where you can call and request the Paxlovid, and there's a medical person that answers whether you're their patient or not, and they will arrange for you to get a delivery of Paxlovid based on your risk. That's not available every place else. And what I am seeing is a lot of people are not even aware that that's an option for them.
Dr. Phillips, I want to talk about something I want to expand on something that you talked about. You talked about these boosters, and we've talked about this. You all have been preaching about the vaccinations. You all have been preaching about the boosters. Clarify for the people the time frame. I know you said 4 to 6 months as far as the boosters. I'm just going to share my personal experience. I went to go get my second booster, and I was right at the 5-month mark. And they told me that because of the way it was set up in the computer system, that I had to wait exactly to the 5-month point. Now I'm talking, I was maybe like 6-7 days before the exact date of 5 months. Is it 4 months? Is it 5 months? And if somebody goes one place and they're denied, what options do they have? Talk to us about those that are severely trying to get their boosters.
So I'll just review the whole thing. Again, the primary care vaccine, the primary vaccine series, you've got 3 options right now. You've got the Johnson & Johnson, which is a 1-shot. You've got the 2-shot Moderna, which is a 4-week interval between the first shot and the second shot. And you've got the Pfizer, which is a 2-shot, which is a 3-week interval between the first shot and the second shot. The first booster, which is eligible for individuals 12 years old and older, is available with the Pfizer, And usually that, or Pfizer or Moderna, actually, and Johnson & Johnson, it is a 5-month window between your second of the 2 messenger RNA vaccines or your 1-shot Johnson & Johnson. It's a 2-month after that shot. Between your first booster and your second booster, number one, as I said, the criteria of eligibility is 50 years old or older with medical issues. So that time period is 4 months from the first booster to the second. And the only second booster shots that are available are the messenger RNA category, which are the Pfizer and the Moderna.
Dr. Boykin, if you want to chime in, add anything to that.
Yeah, let me just expound because Dr. Phillips makes a very important point about Johnson & Johnson vaccine, because Johnson & Johnson has now been relooked at, and they're not recommending Johnson & Johnson as a primary series, even as a primary series anymore, unless, of course, is a personal choice or there's no other vaccine available. Because we want you to be vaccinated. If you want to get a vaccine and Johnson & Johnson, the only one out there, then go ahead and get the Johnson & Johnson vaccine. But preferably, you should get one of the mRNA vaccines. And hopefully the new Novavax is the protein base that's coming out, hopefully sometime soon, that the FDA finally finishes reviewing that particular vaccine. And one other caveat to the vaccination in the primary series, they're now recommending that if you are a male, 15 to 39 years old, you might want to spread out your interval between your first and your second primary series to decrease the possibility of getting that myocarditis. So that has changed just a little bit from when we first started this series. And that would make another difference in your timing. The Johnson & Johnson vaccine, I talked about earlier in this series that, I would suggest you get one of the mRNA's vaccine. And I personally got Moderna. I personally got all of my boosters. I've gotten the 4th booster. I would suggest that. Now, here's one thing about the booster people have to realize. Okay, you've gotten your first booster. You've gotten your second booster. But it hasn't been 2 weeks since you got your second booster. You're still vulnerable to get COVID. And there's a case going on right now where a person got their second booster a week ago, and they were ready to travel, and they got a COVID test. And guess what? It was positive. So it wasn't that they had any symptoms, but it was positive. And so, it made a whole different world about it. But then again, the next day, they had symptoms, and probably because they were right at that window where the antibodies were ramping up. So they got natural COVID, they got the booster out there. So it's probably really kicked their butt, excuse my French, kicked their butt at that particular time. But the good news is that how worse would it have been had you not been vaccinated? There are people that are talking about, well, I don't need to get a vaccine because I've had the disease and I have antibodies. Well, the data now shows that the antibodies only last for a few months and then they go away. So that's another myth that needs to be stopped right now. You're not going to get a lifelong immunity if you had the disease. If you had the disease and you had the vaccine, you may have antibodies for a longer period of time. If you didn't have the disease and the vaccine, if you just had the vaccine alone, studies do suggest that you have a longer period of antibodies than you would have if you just if you had the disease or didn't have the disease. So the vaccines do work, and the period of are set there for those reasons, because you need to be able to protect yourself. And the 4-month window, as he talked about for the second vaccine, is significant because it's showing that those antibodies begin to go down at that particular time. Just like the flu vaccine, it'd be wonderful if we could take a COVID-19 vaccine and never have to worry about it again. Well, that's not true, because the same thing with the flu vaccine. We have to get a flu vaccine every year. We have to base on what's already out there. So I just want to say that those are some little caveats, and people need to stop spreading this myth that if they've had the disease, they never need to get a vaccine. They're never going to get it again, because as you can see, even with the second booster, you're still going to get some disease, because the vaccines are not designed to totally eradicate a disease.
Dr. Boykin, talk to us about where the CDC is right now as far as their recommendations. I've heard people indicating that if they are inside a building, they should be wearing a mask. If they're outside, they're okay. There's a lot of confusion. Some people say it doesn't matter. Even if you're still outside, you should be wearing a mask. Where's the CDC at now with the recommendations, and what should people be doing at this point in time as we start to prepare for our summer vacations and breaks?
So I divided into 2 categories of people: those people that are quote unquote normal, and those people that are immunocompromised. And so you have to keep those in the back of your head, because that's what is you're gonna base your prevention or whatever you're gonna do on that. For example, everything the CDC is now recommending, because the judges struck down the mask mandate by the court orders, but the CDC still has very strict recommendations and guidelines. For example, if the transmission rate is low in the community, wherever you're going to go to, then it's your personal choice. I still say to you, because of the variability of these variants that sneak around and do their own thing behind closed doors, if I'm going to be in a closed space where there's probably poor ventilation and I cannot practice social distancing, I'm going to wear my mask, even though I've had my booster. Now, if the transmission rates, and that's green, you heard Dr. Phillips talk about red, but that's green transmission rate. Then if you have a medium transmission rate, which is yellow, if you're immunocompromised and have an underlying illness, you should be wearing a mask indoors. Okay, that's just a given. Now, if the transmission rates are high or red, as Dr. Phillips said, then all bets are out the door, regardless of your vaccination status, regardless of what you've done. If you're going to be in closed inside spaces with other people, you should be wearing a mask. Ventilation, even considering ventilation, because we know that if transmission rate is high, we're going to see a surge in there. Now, outdoor, you probably get a little bit more leeway. If you could be packed shoulder to shoulder people outdoor, you still have to think about, you're going to get a little bit of a contagious effect, but you don't have to be as strict about being outdoors as you would if you're indoors. So again, just to summarize that, I'll say to you this: if you're going to be going to a large gathering and you're going to be indoors, first and foremost, what you need to do is check the transmission rates in that community. And don't check it a week and then go back and say, okay, it's good, because it could change within 24 to 72 hours. So check it the day before you're going to go and plan yourself accordingly. If you are vaccinated, even if you're not vaccinated, you might want to consider getting a home test to see where your baseline is. Go and do your thing, come back. If you have not been exposed, then you can, what I've done, I've checked myself 24 to 48 hours later. If you have been exposed to somebody in those cases that had a positive test, the day of the test is considered day 0. You should get tested on day 5. So those are things you got to think about if you're going to have large gatherings. And don't travel if you know you're going to go to a high area. I would just say just don't take the risk. It's not worth it.
Dr. Phillips?
I think the other thing we've got to be mindful of, and especially when we look at large gatherings like national convention, you've also got to be mindful with what you bring into a low risk space. Like right now, we are in the 2nd district, we hot, and we have to be mindful of that. So I think some of these additional steps that Dr. Boykin mentioned, like, maybe being more sensitive to any symptoms that may be presenting before you depart, avoiding unsafe circumstances before you depart, getting a test done on the day of or the evening before you depart. And then, once you get there, practicing like you don't want to give anybody else or any gifts other than the gifts that we're supposed to be giving. When you return, again, this is what the home tests are for. If you have had one test when you get home and it's negative and you're concerned, like, me and Ampofo were in the car and he said he was positive, and I know this one is negative, you want to repeat it 24 to 48 hours later, because as we've said before, these home tests have a degree of the numbers not being correct. So we've got to take that into consideration.
So, Dr. Phillips, can we just be real for a second? I mean, people talk about keeping it 100. It's immediate past life now, so it's a little bit of a different tone. Dr. Phillips, with you and Dr. Boykin, and of course the horsemen, all of you all, we talked about the importance of exposure. But even from what you just talked about, you just gave an example. You said you and we in the car. Then a week later, I test positive, you test, whatever the case may be, right? Talk to people about when they test positive. Because, again, We're just gonna keep it 100 for this segment, right?
All right. I'm gonna say this.
Yeah, I tell you. Go ahead.
Well, look, I just got a call from a good brother that I know, and he's one of those brothers that when he comes in town, he can get a group of people to come be around him. And they were meeting down in Maryland, and they met at a cigar lounge. And when he got back home to North Carolina, he called me and says, yo, I tested positive today. So the thread of brothers that are on the text thread that is part of the group that got together with him, what he did was he announced to the brothers that he was positive, and he recommended that everybody else get tested. And me being the as we call it, the 300 health czar, as they said, I recommended a second test if you were asymptomatic and the first test was negative, just to confirm. So I think that transparency, because unfortunately, I think just as we're seeing the media sort of try to move on past COVID, you got people trying to move on past it as well. One of the things, as I may have shared with both of you, that I do for myself, if I'm going to be in a gathering, I put my phone on a 14-minute and 30-second loop stopwatch just to let me know if I'm standing around somebody, it's time to move. If we're indoors, because unfortunately, the times that I have in recent months, 6 weeks, seen cases develop, it's been gatherings, and especially indoor gatherings where you've got more than enough people for a space and you've got individuals without mask. So again, I think we got to be 100 because yes, most people get it. They'd be mild. But unfortunately, and we know this very well, Omega's dealing with other health issues as well. And it's not even just Omega, it's our society. And we never know who are the people that you might come in contact with that may have that vulnerability, that may need that antiviral medication or monoclonal antibodies, or just to know. So I think, again, to your point, brother, immediate past DR, that transparency is critical. And even if it excludes you at an event that you want to be part of, I would rather be excluded than to lose an OG.
Exactly.
Powerful, man.
Exactly. I agree that 100%. And I always tell the brothers this, they call me and say, well, look, I'm just coughing up some mucus or something. I'm just sneezing. I say, get tested. Get tested. Because you don't know whether that's allergies. You don't know whether that's a cold. You don't know what it is. If you've been around somebody that's positive and you coughing up mucus, go get tested. I don't care if it's just, maybe if I say in the old days, maybe I'm coughing up my morning hat. I don't care. In this day and time, COVID don't care. Yeah. As Dr. Phillips always say, COVID doesn't care. So go get tested. And he's, as he said, you need to tell everybody about it, because that's one way we can decrease the transmission in our communities. We can't be too proud when, well, I'm big so I ain't got to tell them I tested positive. No, that's not the way it goes, bro. We got to tell people that we tested positive, because that's one way we can stop. Because oftentimes we are too proud in our communities to fess up that we are sick with something, because we don't want to look like we're weak or something like that. But it's got to be done. You got to fess up and test. I agree 100% with Dr. Phillips. I agree 100%. Test and test again. Make sure there's no false negatives. So
yeah, Dr. Boykin, you must got my note card or something. You went right to my next point. How you do that? So Dr. Boykin, let's talk about that. Just because again, we here for the people. We want to clarify. I know you said if you coughing up mucus, but if there's sometimes, at least my observation, I see a lot of people doing this dry cough, right? What can you tell us? And again, it's one thing, right? You got allergies. Some people legitimately have allergies, right? But then to your point, it could be something else. Can you talk about? Because I'm seeing it a lot. I'm hearing it a lot. Of these dry coughs. Is it the season? Do people need to get checked out? Talk specifically about these dry coughs that I'm seeing in people.
Well, I think two things. It could very well be the season, but the one thing that we've forgotten, we need to go back to the original symptoms of COVID. And one of the original symptoms of COVID was dry cough. So And we know that we have Omicron out there sneaking around, the stealth variant out there sneaking around, messing up folks. So if you got a dry cough and it ain't your usual dry cough, think about COVID. If I'm gonna be around somebody that's coughing a lot, I'm gonna red flags and go up and say, they're really coughing a lot here. I might know them and say they haven't been coughing like that before, so I'm gonna get my my testing done. I'll be vigilant for symptoms in and of myself. So, the dry cough is a significant symptom, and it very well could be your allergies. But again, in this day and time, we're recommending to folks that because we have this pandemic going on, don't just say that it's my dry cough is what I've had all the time, because you could be very well one of those people that walk around with a dry cough, no other symptoms, and you test positive, you'd be spreading COVID. So I would say the dry cough is a red flag for considering getting tested.
This year has been one of those years with my allergy patients, which include myself. Normally I'm like, I don't like taking my medicine, but look, you look like you might have been the guy behind the guy in line, Brother Ampofo, and you heard that cough and you were like, so what I am saying to people is this is the year that you need to be a little more vigilant about controlling it with medication.
Yes.
Now, to your point, if you have been controlling it and normally your medications respond well, but there's this one symptom that all of a sudden isn't going away, go get checked. And again, you don't have to go nowhere. You could do it in the house.
Yes.
I think one of the things that have been very interesting with this variant and the pandemic is how the severity of the symptoms and presenting have changed in severity. Now the symptoms are not as severe. And like I said just a few moments ago, it's not the worry about the individuals that have protection, good health, young age, vaccination, etc. It's about the individuals that are vulnerable. It's about the individuals that are older, have multiple chronic conditions, may not be up to date with their vaccine, including the booster. All of those are scenarios that, unfortunately, if exposed, even if it's innocent exposure, can end up with, as I just mentioned a few minutes ago, my patient who is in the hospital in the ICU right now.
So we've been talking about these home tests. So I just sent the link to our engineer. We're going to see if we can't get that link for everybody for the home tests that people are able to basically sign up for, and they can get a test mailed directly to their home. So we're going to see if we can get that up for everybody. Okay, so here we are, May, basically getting ready for summertime. I want to tie into this thing. I know we've talked about it before, but I think it's even more relevant now. The famous COVID fatigue, right? And specifically as we talk about going to vacation, I want to get out. I'm tired of even, watching the computer screens. Some people watch us, 2 o'clock, 3 o'clock in the morning because they just started. What should we be doing as it relates to COVID fatigue? And specifically, if I want to travel somewhere for vacation, what should I be looking for? What should I be mindful of? How should I prepare for the upcoming summer break?
Well, my take on it is that, as I've always said, have a plan. Dr. Phillips and I have talked about this a lot of times. Have a plan. You know where you're going. You know what the transmission rates are. And let me just preface this into your point is that, we don't want to get to this situation where we are we're not doing what we want to do anymore. We can do it if we just practice certain mitigation. I mean, they're thinking this crazy hepatitis virus is going on in kids right now, but maybe because we sequestered kids, we don't know that to be true yet. So I don't want that to be taken into point as that's true. But we got to live some sense of normalcy. Okay, we got to get back into doing some things, but we cannot forget about the pandemic. So say, for instance, I'm getting ready to go down to our national convention. So I've already planned where I'm going to be, what I'm going to do. But, my main plan is I've already ordered, you mentioned the home test. The first test was 2 free tests. The second was 4 free tests. Now you can get 8 free tests on the third wave of these free tests. So there's no excuse that you don't have a reason to test yourself. It's all available to you. You can't walk into any pharmacy these days without at the checkout counter there's a whole bunch of COVID-19 tests right there for you to purchase. Dr. Phillips mentioned about the oral test. In the DMV area, they're free. Any pharmacy, you just have to have a prescription to get it done. So if those are things keeping you back of your mind. If you're going to be sick, you have a mechanism to treat it. If you're going to go somewhere, check where you're going. If there are elderly people in there, there are immunocompromised people in there, and you're a little bit sick, you might want to think that again. You might want to think that through. Do I want to go get Big Mama, as Wonzie always said, I want to go get Big Mama COVID, get Big Mama whatever, get her a bad cold or whatever like that, because Big Mama might tell you not to come back to her house no more. But anyway, those things, and traveling, we know that they've taken away the mandate about masking on airlines. But I tell you one thing, I'm not going to get on anybody's airline without a mask on, regardless of the situation, regardless of the testing, whatever, because there's always that one person on there that may have tested positive too early, negative too early, and then within 24 hours of getting on that plane are now positive, and they don't know it. They think they're fine. So I would say wear your mask. When you get there, don't gather in places where there's, you don't have adequate ventilation. Try to do most of your activities outdoors. It's summertime now, so we got a great time to do things outdoors. If you're going to be indoors, practice all the things we talked about. Don't get around people are going to be sick. Try to have wide open spaces with plenty of ventilation so that, the transmissibility will be decreased. So that's, let's talk about my take on it is have a plan. You know where you're going. You know the transmission rates are. You know what's going to be there. You know what you got to do when you get there. When you come back, still test yourself, because you got a factor before leaving. You got a factor after leaving. You get there, you get maybe your people you might know, and maybe it's a gathering of people from across the nation. Maybe bringing in things, but getting there is going to be one risk pool. Coming back is going to be another risk pool, and while you're there is another risk pool. So those are things you got to think about in terms of preparing for that. And I'll yield to Dr. Phillips. He might have a different take on it.
No, I agree with you, Dr. Boykin. I think that those things are very, very important, because you're right, Brother Ampofo. People are tired. People want to walk on the grass, as we of Omega don't do. We don't cut no corners. And it's important because, unfortunately, cutting corners, and it's not even just about getting COVID and getting sick and dying. It's about, I don't have 10 days off for my job that I could take off to quarantine. I live at home with my grandma, my mother's mother, who is older. So again, it's about really how does your risk or exposure affect someone you may be in contact with. And as Dr. Boykin has said the whole time, we still don't have a shot for kids 5 years and younger. So that's another population that's, as we may say, butt naked. They're not protected at all.
Yeah. Before we get ready to close, my brothers, and as always, appreciate you, all of the Four Horsemen, sharing this knowledge. I want to see if you all can hit on two quick things. Number one, I've heard instances where people have tested positive multiple times. Can you speak briefly to that? And number two, separately, I know we're always focused on COVID-19, but obviously as medical healthcare professionals, certainly if there's anything else in general that you would want to share with our communities at this point in time. We now hear about monkeypox and a couple of cases that have come out, but if there's anything else just in health in general that we want to share with our communities, if y'all could just touch on those two items quickly, and then we'll prepare to close.
Let me just quickly talk about, everybody talked about doing this whole COVID thing about herd immunity. Well, there's another set of herd immunity people have forgotten about, and that's the routine childhood vaccinations. Because of COVID, the amount of children that needed to be vaccinated for the first time in a long time fell below that 95.2%. I believe that's correct. 97.2% needed vaccinated children for herd immunity. So we may be looking at a resurgence of some childhood diseases. Right now, we have an outbreak of measles in the Northern Virginia area. And that was brought by somebody from another country. But, we got to realize that our vaccines and disease in this country are not the same as vaccines and disease in other countries. So, we can't hesitate on our normal health care. please do not compromise your children's routine vaccination, because you can see now that we can crop up, have cases. Not too many people die from measles, but you can still die from measles in this day and time. You can get very, very sick from measles in this day and times. So that's also as compromised that I mentioned briefly about the hepatitis going around. What have we done to our children by, not exposing them to different things, by the fear factor in the whole COVID thing? That's one aspect of it. But at the same time, we can't be going out having COVID parties either. Like we have measles party and chickenpox parties. That's not the way to do it this day and time. So we cannot neglect the things that we should have been doing all along to protect our children, because those are the ones that's most vulnerable. And thankfully, I'll say that we have a mechanism for treating even our younger children if they should contract COVID. For 28-day-old babies can be treated with remdesivir if they should contract COVID. So that's a great thing that's going on right now. We got to protect our children. But our healthcare, and just general healthcare has been lacking. And the sad thing that distresses me the most is that because of this pandemic, mental health, which has already been a big stigma before we even got COVID, has gotten worse because we don't go and take care of ourselves. We're too proud to take care of ourselves. If we're hurting, if we're anxious, if we're depressed, we can't ignore it. We can't let COVID be a reason why we don't continue to take care of our medications. We don't continue to see our therapists. We don't continue to do things we need to do. So I'll yield with that to Dr. Phillips.
Well, the first thing I would say is to your question about the multiple positive tests.
Oh, yeah.
Again, as we've talked before, a person that has had COVID can test positive 6-8 weeks after having and being exposed to it. So as we've mentioned before, testing is not the preferred criteria from exiting the quarantine protocol. Again, I'll just reemphasize, you want to quarantine 7 days, and in the last 2 days, you should not be having any symptoms and definitely not taking any symptom relieving medications, because if you are, that means you're still symptomatic. So asymptomatic and not needing any symptom relieving medications for 24 to 48 hours on the tail end of your quarantine is much more important for you exiting quarantine as opposed to using a test to test out of it, because there's a chance that the test could still be positive for some time, yet you not have any symptoms. To your second question, which is, what do we need to be thinking about? You know what I'm starting to see right now? I'm starting to see that all of us may know someone that had a heart attack or a stroke during COVID. And you know why? Because they weren't on top of the medical conditions that put them at risk. Unfortunately, and I've said this from the top, we African Americans have been the low-hanging fruit with respect to this COVID pandemic because of our poor overall health status from the outset. What I mean by that is we've got a majority of us, or a good amount, that don't even have a doctor, don't go to the doctor. So if you don't do that, how are you going to know what are the things that I need to be mindful of? As people have heard on many occasions before, blood pressure doesn't always present with a symptom when it's mildly elevated. It usually presents when things are really, really out of hand. So individuals have to be mindful that I need to stay on top of my chronic health. I need to stay on top of my preventive testing. I just had my colonoscopy 2 weeks ago. Again, it was rescheduled from December to now because the numbers were going up. How many people have I spoken to that if that has happened, they never followed up? So what if I had a lesion that was there in my colon and I never went back? The next time that it might present or become an issue, I might be in a place where it's a big problem now. So my point is, and this is to the people that want to immunoboost and use their own natural immunity. If you're not in a good, healthy state, if your chronic conditions are not well controlled, that preference that you have to avoid and use your own body's defense mechanisms to prevent COVID is not going to be as strong as you think it might be. Last but not least, hey, think about the vaccine. We get a flu shot every year. Don't let, I got the first shot, I'm not messing with no more COVID shots. No. Every single COVID shot that I need or am eligible for, I'm going to get. Because, knock on wood, God bless, I've been protected. And I've been able to move and to address in my life and handle my life with, no more than the regular limits that COVID has put upon me. But as we have said throughout this talk and the previous ones, individuals that don't have that type of protection, we are still seeing, and that's been the consistent statistic throughout the pandemic. How do people that are not vaccinated do if they get serious COVID? And that has been consistent. So those are my take-home points. Again, I really do appreciate, Brother Ampofo, what you have been able to do leading up to this. And I am very thankful to our current district representative for allowing us to continue, because this message about COVID is still needed. But more importantly, we need to continue this message of prevention, not just with your physical health, but as Dr. Boykin just said, also our mental health.
Absolutely. Dr. Boykin, take us home with your closing remarks.
I have one simple thing to say, and that is, don't forget COVID. Don't get caught up in all the media. Don't get caught up in all the political stuff that's going on, and don't get caught up in the war, because COVID is still out there. And I'm going to say it now, even though they haven't said it, COVID is going to be with us for some time. It's going to be an endemic just like the flu. But it doesn't mean you can't go out and enjoy yourself and do all the things that you want to do if you take the necessary precautions. Pay attention to what's going on in your area. Follow your local guidelines in terms of taking care of things and visiting and wearing masks and things like that. If you're not sure, it's always safer to wear a mask. Don't forget about the children. They are the most vulnerable. They're the ones that have to be protected against the adult diseases. They might not get as sick as some of the older people, but they still can contract COVID and die. So please protect the children. Don't forget their routine health care. Don't forget your routine health care. Have a plan for where you're going. Think about where you're going, who you can see, who you're going to be with, and plan accordingly. We've got to the point now that we've got enough data. We realize what we're dealing with. We realize how we can take care of this and protect ourselves. So go out and have fun this summer, but don't go out and ignore COVID, because COVID will come right back around and put you down. So with that, I'll yield my time. Thank you so much, Brother Pass, DR, because I tell you, this has just been one of the things that dearest to my heart. And I'm so grateful for Brother Coles to allow me to get together and continue this thing. And I'm so thankful that you agreed to come back at least moderate this thing for us, because I think this is a very, very important issue. And I think everybody inside and outside of Omega realizes that. And we have more and more forums going on. So again, thank you so much for all of the time and effort you spent on this, Brother Ampofo. I really personally greatly appreciate it.
We appreciate all of you. And we're not going to forget our main man, Pissy, behind the scenes, driving this thing. Dr. Phillips, take us home, please, with your remarks.
Well, as I said, I think that, we need to recognize what our risks are. We need to recognize what protective resources we have. We need to recognize what type of symptomatic things that we have available if we are affected by COVID. We need to get our regular preventive health visits and make sure that they're current. We need to make sure that any other preventive tests or vaccines that we are due, we should be on top of them. In addition to that, as Dr. Boykin mentioned earlier, when we're traveling, we need to be mindful of where we're going as far as it pertains to COVID, and where we're coming from as it pertains to COVID, so we can act accordingly in protecting ourselves. So with that, again, we still have to be vigilant. Yes, it's milder than it has been in the past, but for those that are at risk, it may not be mild for them. It may be this is the end of life, or life-altering type of ordeal. So those are my remarks. Again, I echo what Dr. Boykin said about just how appreciative we are of you, Brother Ampofo, for initiating this platform back then and continuing with this platform even as you transition into your immediate past role. Thank you, my brother.
As always, I appreciate you all. And as indicated, no pass like a media pass. Let me take this time to just simply, first of all, thank the brothers of the second district for allowing this COVID-19 task force team to be able to provide information to the brothers on a weekly basis and with this monthly webinar series to communicate out to the world. Also, let me take this time to give a shout out to all the graduates of 2022. I am here where graduation took place earlier today, and just certainly want to send love and congratulations to all the graduates of 2022. That includes my niece, who is now a doctor, so hopefully she'll be joining us soon. Shout out to my niece Danielle. Happy belated Mother's Day. We're still in the month of May, so to all the mothers, all the grandmothers, all the sisters, happy Mother's Day. Thank you so much for all that you do. And as we know, brothers, next month, Father's Day is our month. So make sure we take the time to spend with our families, do those things that fathers do. Last and certainly not least, we must remain in a posture of prayer. We're still dealing with the unfortunate incidents that happened in Buffalo, the shooting, and even now we deal with the most recent shooting in Texas, which occurred at an elementary school where elementary school children, unfortunately, have lost their lives and a teacher. So let's continue to make sure, or we remain in prayer for our families and each other. As always, last and certainly not least, as I always suggest, as I always recommend, please make sure you take time, donate blood. Blood saves lives. So please make sure you take the time to donate your blood. My name is Kelvin Ampofo, the immediate pass second district representative. And certainly, as always, we want to thank our current 38th district representative, Brother Del Rico Gales, him and his entire council team. Thank you all so much for all that you do. With that, continue to stay blessed, continue to stay well. Brother Piercy, shout out to you and all the brothers on the IT team, Brother Worley, Brother Ed Hill, who make this thing available for everyone that watches us. Thank you all so much. We'll see you next month. God bless you.